Hello, my name is Ashley MacDonald, and welcome to my online module entitled Improving APRN Communication Skills When Delivering Bad News to Patients, the SPIKES Protocol. As we all know, when we are tasked with delivering bad news to patients, it's not the most comfortable time that we have with them. But what I'm hoping is that through this module, you will have a new strategy to take into your practice to make it a little easier. A little bit about myself. I'm a registered nurse and currently a family nurse practitioner student at the Elms College in Chicopee. And this presentation is part of my capstone project, which is a requirement to obtain my degree as a Doctor of Nursing practice. The objectives for this module is that you will be able to identify the effectiveness of an online learning module, specify situations in which the SPIKES protocol would be beneficial to help guide the conversation, and describe aspects of the SPIKES protocol that could increase comfort and confidence when communicating bad news to patients. In order to measure these objectives, I will ask that after completing this module, you will look below in the web page and click on the link to the online survey. So I keep using the term bad news. So for the purposes of this project, bad news is considered any information that could negatively alter the patient's perception of his or her future. So whether that's a new diagnosis, deterioration of a chronic condition, or the need to transition over to hospice or palliative care, even death of a family member. It's very important to remember in practice that bad news is subjective of the patient. So meaning what the provider might view as bad news is not necessarily what the patient will, and vice versa. But when we break bad news to our patients, it requires specialized, ongoing, accurate communication, which traditional communication styles may not be effective enough. So just a little background about communication and communication skills. As we all know, working in practice, communication is really the cornerstone of providing the best care we can for our patients. We communicate daily with patients, family members, the physicians we work with, physical therapy, all of our interdisciplinary teams. And we may not have the best skills when we first enter into practice. And a lot of the time it's on-the-job training. But through my research, I have learned that communication skills can be improved with education. And when we can really clearly and effectively communicate with our patients, it positively impacts their care and increases their understanding and adherence to our treatments. And that really allows us to provide the high quality care that we strive to provide. Another note is there's very little formal education on the art of communicating specifically bad news to our patients and families. Often the first time we even learn about it is when we are tasked with the delivery of a new diagnosis to our patients. And as I said before, traditional communication techniques may not be sufficient enough during these difficult conversations. So now I'd like to talk specifically about the communication of bad news. It happens frequently in practice. It's an unavoidable thing. It's important that the APRN be prepared with a strategy to engage in these type of difficult conversations. Throughout my research, I identified that one of the biggest barriers is the level of comfort and confidence that APRNs have with engaging in these conversations. I also identified that the use of a protocol or guideline can assist in guiding the conversation, making it a little bit easier for the APRN. So that brings us to the SPIKES protocol. It's the most common guideline that I found while I was doing my research for this project. It does provide an organized structure to guide difficult conversations for any healthcare provider, really. It was developed in oncology in the 1990s to help them guide the conversations, but is now shown to be effective in many healthcare settings across the board. It does improve our communication skills, and it's been shown to improve confidence as well as encourages patient-centered care. So what is the SPIKES protocol? It is a 6-step guideline, which is used they use an acronym. So S is setting, P perception, I invitation, K knowledge, E empathy, and S summarize. So now I would like to take you through each step in the acronym. So the first S in Spikes is setting. This step is where you plan for the conversation. So you've gotten the lab results, you've gotten the tests you need, you found out the diagnosis, and now you have to plan to talk to the patient. So you want to make sure all the information that you have is available for this first conversation, including treatment options. You want risks and benefits, what can and cannot be done, and rehearse the conversation and be prepared for the conversation. We always want a location that promotes privacy and quiet. So not in a hallway, not in an elevator, in the cafeteria, privately in your office, and allow for time. So I know that this may not be the easiest part because we have 10-minute, 15-minute appointments, but if we could get an extended appointment for these conversations, as they might require a bit more time than the standard appointment. So when you begin, you need to ask the patient who they would like to be present, silence your pagers, minimize interruptions, distractions, hold your calls, maintain eye contact, and focus attention. You want the patient to feel that you are there with them. This has been, I found it either way in the literature, telecommunication. So if you want to if there's a diagnosis that you feel needs to be timely relayed to a patient and they're unable to get to you, whether they're homebound or they have other appointments or they just live so far away, then telecommunication may be an option. The P in the Spikes protocol stands for perception. So during this step, we want to find out what the patient knows or what they think they know about their current situation or diagnosis. So this is the time where we'll correct any misunderstandings or misconceptions and evaluate their coping strategies. We also want to identify if they have any over-optimism about their condition, or they're avoiding it, or if they're in denial. So how are we going to do that? So suggestions of how to do that is to ask open-ended questions. So things like, what have you been told about your medical condition? Can you tell us your understanding of your illness or your medical situation? That'll allow you to evaluate their knowledge of where they are right now and to correct if needed be. Also the statement, tell me what you have been told so far. That'll give us a lot of information of where they've left off in their conversation with maybe another healthcare provider. So perhaps they went to the ER and got a partial diagnosis, but there was further testing needed. The I in the Spikes protocol is invitation. So throughout this step, we want to ask the patient permission to share this bad news with them, and we want to know what information they want to receive. Also, if they need somebody else there with them at the time. Some cultures prefer to have a family member told first, so that could be something to think about. Ask the patient if they want somebody else told. Because if the patient is not prepared to hear the news, it can really create a lot of misunderstandings. And then some factors that could affect information sharing, I will be discussing later on in the PowerPoint, but these factors are culture, health literacy, developmental level, and age. So how do we invite ourselves into the conversation? So we just ask them, would you prefer if I told this to another person first? Would you like anybody else with you while I explain your test results? You could also ask a question such as, do you want me to go over the test results and explain what I think is wrong? Some patients want all the information, some patients don't want any information. So it's important to ask these questions prior to giving them the information. So we've provided the perfect setting. We found out what the patient already knows, and the patient has allowed us to share this information. So that brings us to the K, which is knowledge. This is the step where we actually share the bad news with the patient. We're keeping in mind that we're going to avoid medical jargon, We're going to speak in a way that the patient can understand. Slowly, don't be blunt. Work through expectations, unrealistic expectations, explain what can and cannot be done, provide some treatment options or lack thereof, and then pause. Allow time after you share this information for the patient to take it all in and process it, because this is going to be a blow to them. So we'll start the conversation with a statement. I have some serious news to tell you. I'm afraid the news is not good. I'm sorry, but I have some bad news for you. And again, then after you start with a statement, you go into sharing the news with the patient and then pause and allow them a few minutes to really digest this information. The E stands for empathy. So this step is important to display your understanding for the patient, because empathy is an awareness of other people's feelings, an understanding of other people's feelings. And you really want to show that to your patient, show them that you care for them. Just because you feel bad, though, just remember that you shouldn't be prematurely reassuring the patient that everything is going to be okay, because that might not be the case. This can be done both verbally and non-verbally. It requires active listening. So you want to give the patients time to react. So they've digested the news and now they're going to react. There is usually some sort of reaction, whether it's negative, it's anger or crying, but you have to remember that it's not personal to you. There's just a lot of emotions when somebody gets delivered bad news. So examples of empathy here are, you want to let the patient know you care, maintain eye contact, lean into the patient, show them, create an environment of intimacy, and ask them, can you explain to me how you're feeling right now? So this is going to bring us to the final step, which is to summarize the visit. You want to summarize the information that was presented and start making a plan for follow-up. This has been shown to reduce the anxiety of patients. Again, you're going to speak in language that the patient can understand, avoiding medical jargon, review their expectations of care, and really include them in the planning for the future. You want to ensure understanding by the patient as well as the family members. Ask them what their understanding is if they discuss. Make sure if they have any questions that they're answered. Let them know that they can always contact the office if they have any further questions when they get home. And then verify what you're going to be doing for follow-up. Talk about the treatments and get the appointments gathered and what they can expect. Phone calls from our office, scheduling them with different providers if needed be. So other considerations and barriers. So first, non-English speaking patients. We want to ensure that they are receiving accurate information. So not allowing family members to interpret, as the message could be altered. They could be protecting their family member or just not understand what we're saying. So use the health system approved translator. There's the language lines, and there's also computer-based translators. Health literacy. So make sure to speak clearly, as I've said through this entire module. We're not going to speak in medical jargon. And we're going to consider the patient's educational level. If they're a high school dropout or a 4th grade education level, then that's really how the information needs to be conveyed to them. And just remember to be culturally competent. Be sensitive that there are differences among cultures. And as I was saying before, some cultures, the patient isn't even involved in these conversations. So communicating bad news, it can be stressful and uncomfortable, and it does require excellent communication skills. But using a guideline has been shown to alleviate some of that stress and really guide the conversations with the patients in practice. The SPIKES protocol, again, is a 6-step protocol that offers an organized approach. And I hope that you now feel confident to use it in your practice, as it can lead to some real high quality conversations. Thank you so much for taking the time to participate in this online module. Don't forget that below there's a link to the online survey, as well as a quick fact sheet for you to take for reference.